So before coming into the room, I would check the electronic health record to look for doctor's orders, medications, and just to generally kind of see what's going on. So I've checked that. Hi, Anna. My name is Maddie McIntyre. I'm going to be your nurse today from 7 to 3.
Great.
Awesome. All right, and if I could actually just get your name and date of birth.
Anna Evans, 9/18/97.
Okay, awesome. Thank you. And what brings you in today?
So last night I came into the ER because I was having some pretty bad pain in my left side right here. And they did an ultrasound and they found that I had a pretty big ovarian cyst, and that had made my fallopian tube twist. So they took me into emergency surgery and I twisted that and took the cyst off. So that's why I'm here.
Okay, I'm glad to hear that they were able to do that for you.
Yeah.
When did you first start noticing that pain?
It was kind of aching yesterday, afternoon around lunchtime, but then in the evening, it just out of nowhere, just was a super sharp pain.
Okay, and there was nothing that would alleviate that pain?
No, my mom grabbed a hot pack as we were leaving to try to help, but that didn't really do much.
Yeah, that makes sense. Okay, and what would you have rated your pain then?
Oh yeah, then it would have totally been a 10.
Okay, and now what would you rate your pain?
A 3. It's just more achy now.
Okay, awesome. That sounds good. So moving on, we're going to do a little bit of a general assessment.
Great.
And to do that, I'm just going to look at your facial expression, which is appropriate. And I'm also going to look at so far you've been able to respond to me, which lets me know that you don't have any hearing deficits, and you've also been making eye contact with me, which lets me know that you don't have any problems with seeing. We've been making eye contact and such. And it seems like your general hygiene is very good, and your body position is comfortable, and you are conscious. You have a alert consciousness. And do you know where we are right now?
We are in Shadow Health General Hospital.
Awesome. And do you remember who I am?
You're my nurse, Maddie.
Awesome. And do you know about what time it is?
It's getting close to 9.
Yeah. Awesome. Okay, so she's alert to person, place, and time. And that's very good. And I'm looking at her skin color, and it looks generally pretty even all throughout. There's no visible signs of cyanosis or any rashes or things that I should be worried about. So feel good about a little bit of a general survey, and we are going to move on to some vitals. So to start with, I'm just going to take your temperature. Alrighty. So to do this, I'm going to pull the pin off out and back. Just let me know if there's any pain with that. And that is at 98.9, which makes sense that it might be a little higher coming from the ear, but it's still within normal levels. I'm going to take your pulse ox. There's that. And while I'm doing that, I'm going to take an apical pulse for you. I'm going to come around the other side. I'm going to take that apical pulse for a whole minute. right, awesome. And that is at 81 for your apical pulse. Let me come back around. And your pulse ox is at 98, which is what we like to see. So next, I'm going to do a little bit of radial pulse and check your respirations. Alrighty, that sounds good. Respirations are at 8. And next we're going to move into doing a blood pressure. So make sure your ankles are uncrossed. Perfect. And we're going to be doing a 2-step today, which basically just makes sure that we're not going to pump it up too much, which could hurt you. So.
Okay.
Alright. So to start, I'm just going to feel for the radial pulse and pump until I can't feel that anymore. Alright, and that was right at 110, so we're going to pump to 130. And just generally note that when you take blood pressure lying down, it might be a little bit lower. And that was about 100/60. Awesome. And we've already assessed your pain, so for vitals, that's all good. Next, we're going to move on to a neurological exam, and doing this, we use the Glasgow Coma Scale, which assesses first the eyes, and I see that they've been moving spontaneously throughout the interview. So just kind of going along with eyes, I'm going to assess for pupil size first, which looks to be about a 4, so that looks good. And if you just want to keep looking right at my nose. And those eyes are reactive and consensual in their reactions. And so that's good for eyes. And next we're going to move on to the best motor response, which throughout the interview has been appropriate, and that's good. But we're also going to check if you could just squeeze my fingers. Perfect. And then I'm going to pull against your arms. Could you provide some resistance? And I'm going to push. Perfect. And then the same with the feet. Pull up and push back. Alrighty. And if you could just lift up one leg for me. Perfect. That's just what we like to see. And I also don't notice any facial drooping, no ptosis, and have you had any difficulty swallowing?
Nope.
Nope. Okay, which is very good, and that leads us into the best verbal response, which throughout the interview has been appropriate and coherent. And next we're just going to move on to respiratory. And to start, I just have a few questions for you. Have you been having any difficulty breathing?
Nope.
And I noticed that her breathing has been unlabored throughout the interview. And have you been having any coughing?
No.
So no mucus with that?
Nothing.
Alrighty. And so first what we're going to do is auscultate 6 lung sounds anteriorly and then 8 posteriorly.
You can sit up if that's helpful.
Yes. And then I'll just...
Here, I'll pull this up. Thanks.
Perfect. Perfect. Just keep breathing normally. That'll do. Perfect. And those lung sounds are clear anteriorly. Alrighty, and posteriorly, those are also clear, no adventitious sounds. So yeah, perfect. And moving on from that, here, I can help you get that.
Thanks.
We're going to be doing some cardiac, which to assess, I guess I'll have you sit back up.
Okay, great.
And we're going to listen to the heart sounds in the form of atrial, pulmonic, Erb's points, tricuspid, and then mitral. And I'm going to do that twice, first with the diaphragm and then again with the bell.
You can pull this down too if that's easier.
Yes, that would be perfect. I'll come under for this part. Alrighty. Okay, perfect. And those sounded regular, and the S1 was heard most strongly down at the apex of the heart, while the S2 was heard best up at the base. And while we're also doing cardiac, I'm just going to assess your radial pulses. And those both feel strong. I'd say a 2+. And check your capillary refills. Less than 2 seconds on both. And I'm going to feel for your anterior. Okay, thank you. I'm going to feel for your anterior tibial pulse, which is a 2+, and your dorsalis pedis, which is also 2+. Let me just do this side as well.
So you can see.
Oh yes, perfect. Strong. And there we go. So I'd go with 2+ on this anterior and a 1+ on the pedal pulse. I'm going to do capillary refill test on both feet. And less than 3 seconds. Put your no-slip socks back on.
Thank you.
And while I'm down here, I'm also assessing for any peripheral edema in the ankles or feet, and I don't see any, which is a good sign. If she had an IV, let me come back over here. If she had an IV, I would be sure to check the rate and the amounts just to make sure that they were with doctor's orders. And that takes care of cardiac. Moving on next to skin, we've done a little bit of assessment, but I would assess the IV site if there was one to make sure that there was no signs of infection and that there was no drainage that was bad. I'm also going to assess the surgical site. And the edges are well appropriated and there's no signs of infection. There's just a little bit of redness that seems normal with surgery. And I'm also going to check the skin turgor of the forearm, which is no visible signs of dehydration with that. It was quick to go back to its normal shape. And her skin feels warm and dry both on her arms and on her legs, which is a good sign. Then using the Braden skin breakdown assessment, I would ask her about her nutrition. So if you could just tell me a little bit about what you've eaten in the past 24 hours.
Yeah, this morning I had a bagel with cream cheese and some coffee, and I think last night they gave me some apple juice and some crackers after surgery, but I haven't eaten a whole lot yet.
Okay, awesome. But just based on her general health, I would say that we don't have a risk for any nutritional deficiencies that would make the wound healing worse. And I am going to also ask, there's no diaphoresis, which is good. And also she is able to move and active, which also decreases the risks of skin breakdown. And there's not a lot of friction or shear forces acting on her body, which is really good. And then if she had any specialized bedding, I would check that to make sure it was working well and working as the doctor had ordered. And with that, we're going to move on to the abdomen. So first I'm going to assess the abdomen. I'm going to assess the abdomen and the contour. And the contour is flat, which is what we like to see. I would then assess in all 4 quadrants, starting with the right lower. I'm going to gently do that on the bottom one too. And all 4 bowels have active sounds in each quadrant that are present. And so next I'm going to palpate her abdomen, but I'm going to avoid palpating the area where she just had surgery. And please just let me know if there's any tenderness. And I'm moving in a way so that I don't miss any parts of the abdomen. And again, starting in the right lower and moving to the right upper, left upper, and then I would go down to the left lower. And I didn't feel any distension or masses, and there was no tenderness, which is perfect. And I'm just going to ask you, have you passed any stool or flatulence since the surgery?
I had a bowel movement this morning.
Okay, awesome. Could you tell me a little bit about that? Was it about a normal bowel?
Yeah, it was a little softer, but that didn't alarm me, and it was still a normal brown color.
Okay, awesome. That's what we like to hear. And if she had a gastric tube or an end tube, I would check for drainage and make sure that things are looking good with that and assess the skin around that as well. And so to move on to genitourinary, have you been able to void?
Yes.
Awesome. Okay. And could you describe the color of that for me?
Yeah, it's been a normal yellow.
A normal yellow. And would you say that there's been any cloudiness with that?
No.
Pretty clear? Okay. And has there been any pain with that?
The first time after surgery, but after that
it was a little painful. Okay. And if she had a catheter, I would check the catheter for if it needed to be cleaned, also if it was patent and working. And also if indicated, I would check and use a bladder scan, but she's doing well. And would you say that the amount that you've been urinating is about similar to what you did before the surgery?
Yeah.
Okay, awesome. And then moving into activity, I noticed you're pretty mobile. Have you been having any trouble moving around to go to the bathroom or anything?
Nope.
Okay, so you don't think you'll need the assistance of any assistive devices, a cane or a walker?
No.
Okay, and if she were immobile, I would implement a turning schedule, and I would also make sure that the head of the bed was raised or lifted as was appropriate. I would also check any TED hose, SCDs, or foot pumps to make sure that they were in accordance with doctor's orders and doing what they were needed to be doing. And then finally, I think that's actually all for activity. I would do a fall assessment risk. And to do that, I would look at the medications that she was taking. I would also look at her past history of falls and her levels of consciousness, which we assessed earlier. She's alert. She doesn't have a history of falls. And her medications, she's on an opioid for the pain for her surgery, but I'm not too worried about she's alert, and she doesn't have any other medications that would add to that or make that too much to handle. And I think that's all. If you have any questions for me, here's your call light. I'm going to make sure your bed is locked and lowered, and it is. If you need anything, please just give me a call. And thank you so much for your cooperation. Let me wash my hands. And I would leave. And that is the end of this reassessment. Thank you.